Uchunguzi kuhusu kupatikana kwa maiti za watoto 11 katika hospitali ya Pumwani unaendelea.
Wahudumu wa afya katika hospitali hiyo wanakanusha madai ya utepetevu na kusingizia ukosefu wa vifaa. Mwanahabari wetu Kadzo Gunga amekuwa katika hospitali hiyo na sasa tunaungana naye moja kwa moja atufahamishe mengi zaidi. Awali alikuwa ametuarifu kwamba waziri wa afya katika kaunti ya Nairobi katika jimbo hili linalosimamiwa na gavana Mike Sonko alikuwa azungumze na wanahabari kuhusiana na hatua zilizohitajika kuchukuliwa kutoka jana. Kadzo Gunga, sijui kama ashasema na wanahabari na kama amezungumza, ni yapi aliyosema?
Na bado ni mrotabu kama unavyoona hapo nyuma yangu, ni kwamba tayari wanajiandaa sasa ili waweze kutuongelesha na kutupatia taarifa kamili kuhusiana na ni yapi yaliyojiri ama kuhusiana na uchunguzi ambao umekuwa wakiendeleza huko ndani kuhusiana na tukio la hapo jana ambapo gavana wa kaunti ya Nairobi Mike Sonko aliweza kuzuru hospitali hii ya Pumwani na kupata miili ya watoto 11 ambao walikuwa wamehifadhiwa katika lailoni na boksi katika chumba cha kuhifadhi dawa katika hospitali hii ya Pumwani. So kwa muda mrefu waziri wa ama katibu wa afya katika kaunti ya Nairobi Veska Kagogo amekuwa katika mkutano pamoja na wawakilishi katika bodi ya KMPDU ili kuweza kubaini yaliyojiri, na kwa muda mfupi tu kutoka sasa wataweza kutujuza ni yapi ambayo wameweza kugundua ama ni lipi ambalo limeweza kufanyika kuona kwamba hospitali hii usimamizi wa hospitali hii ulizembea wapi ama ni vipi hospitali hii inakosa vifaa mwafaka vya kuweza kuhudumia wanawake wajawazito wanapofika katika hospitali hii.
Nairobians get the best service. So with me, I want first of all to give an opportunity to the Chief Officer Health, Mahat Jimale, to give the exact report on the deaths.
First and foremost, most welcome to Pumwani Hospital, the biggest maternity referral hospital in Eastern Central Africa. First of all, you have to know Pumwani is purely a maternity hospital. Secondly, Pumwani Hospital, just like NH, is a referral hospital for mothers who are pregnant from across Kenya. And when I'm saying Kenya, precisely also in Nairobi, where we have low socioeconomic settings, the urban slums, which form 60% of the Kenyan population, Nairobi population. I wanted to demystify some myths that Pumwani Hospital has a number of unaccounted bodies or stillbirths that are not from the hospital, according to the media. The truth of the fact is that out of the 11 bodies that were confirmed yesterday, we can entirely account for each and every child with the tagging and notification of deaths. So clear account of the summary is, out of the 11 deaths that happened between Wednesday to 11th and 17th of September, that is how many days? 6 days. We had 244 deliveries and 11 deaths. And I want to account for the 11 deaths. Out of the 11 deaths, fresh stillbirths, which we say fetus with no signs of life, weighing less than 1,000 kgs, were 1,000 grams, were 4. Fresh stillbirths were 4, and out of the 4, the main reason or the reasons for their death is no heart rate on arrival for 2, and the one we had advanced labor breech delivery obstruction, and similarly for the 4th one. So those 4 can be accounted for, and the complications and the support given by our top ops guys is available with us. Number 2, out of the 11, 2 were macerated stillbirths. and these 2 stillbirths were weighing 2.2 kg and 3.5 kg respectively. So the main reason for the macerated stillbirth had to do with protracted labor and antepartum hemorrhage. The other 4 were basically neonatal deaths. And out of the 4, the causes were purely, number 1, birth asphyxia. Number 2, referrals from health centers like Mukuru, where the kids scored badly on ABGA, and prematurity of 32 weeks with a child weighing less than 1.7 kgs, and then another child weighing who was 32 weeks, also weighing 1.6 kg, and by the time the child was brought, came with respiratory distress and sepsis. And the last one, I've said 11, I've accounted for 10, was a child who was brought in dead by a Kenyan, so that Mama Lucy, Pumwani Hospital can safely dispose the child. Complications that arose, and it's very common, and I've said these are referral hospital, the kind of mothers we get come with a lot of complications. Of common, obstructed labor, sepsis. We have mothers who come with eclampsia or preeclampsia, mothers who come with ruptured uterus, mothers who come with severe sepsis, or obstructed labor, final stage, let's say the 3rd stage, delayed. So the mitigation measures and interventions that are ongoing is we have maternal and neonatal mortality survey done every week. At the Nyayo House, where the headquarters for the department is, we have a review committee that sits once every month. Number 2, at the level of the hospital, headed by the in charge of Ops guy, they have a weekly review meeting for neonatal deaths and 48-hour review meeting for maternal deaths. So, in addition, and I'm sure a number of times I've talked about this in a number of forums, one of the interventions which is coming up probably in the next 3 to 5 months is putting up critical care units in this hospital. And specifically, the neonatal ICU and maternal ICU. The space has been provided. Some of the equipment are with us, but we want to have, let's say, a minimum 10-bed ICU for neonatal because of the number of deliveries we're dealing with. And you very well know where you cannot compare Pumwani with any other facility in East Africa because we're entirely dealing with maternal cases. And we're dealing with newborns and a number of referrals. So establishment of neonatal ICU and maternal ICU is critical to reducing this mortality rate because we are getting extremely complicated cases. I think I don't want to exhaust a number of issues I wanted to discuss because operational issues will be tackled by our minister. Let me give 1 minute to wacha tumalize. Yeah. Let me give 1 minute to my able pediatrician, who is the acting med sup, to give a brief review or overview of the interventions we've put in Pumwani as a center for excellence in terms of maternity services. Dr. Karibu.
So thank you, Bona CEC, Madam CEC and Chief Officer, and thank you all who have come to be with us this afternoon. Yes, indeed, we have put measures to mitigate against some of these complications. As he has said, we had quite a large number of mothers, and most of them actually do come late, and they come with complications. So when they arrive here, they are actually received by skilled workforce. Our midwives, they are trained in what we call emergency obstetric and neonatal care, which we keep reviewing on quarterly basis to ensure that they are well skilled. We have also taught them on basic neonatal resuscitation in as much as we are waiting for advanced measures like what our Chief Officer has alluded to. So with this training, we have capacity build. We have done enough capacity building of our staff. Apart from that, we have other low-cost, high-impact interventions we have put in place. You've already been told that 2 of our babies that we lost were because of prematurity. So one of the key interventions we've been carrying out is what we call kangaroo mother care, whereby we utilize the mother to offer the warmth to the baby. And this has really changed the narrative of our statistics here. We have managed even to reduce their time period, hospital stay period, from initially 2 weeks to the current 1 week. The other intervention we've done to take care of our neonates is supporting them respiratory-wise. We are using what we call Cpap respiratory intervention, whereby even without ICU or advanced airway support, you can be able to support these children using basic equipment to help them, stabilize their breathing activity. The other thing we have done, as I'm sure you've read in the news, we are in the process of initiating a human milk bank, which will actually be a first for the Republic. And that will go a long way in actually ensuring that our small babies who are vulnerable get enough nutrition.
You have talked about people, or rather mothers, who come here to deliver, being received with a great workforce and skilled people, personnel. What's the ratio of the patients to the doctors here?
Okay. Currently we have 5 gynecologists, and we have 12 medical officers and 3 clinical officers. Of course, that's not an ideal number, but we are making do with it. And every mother who comes actually gets attended to by a midwife and a doctor, a qualified doctor.
What about the number of wards? How many do we have? And currently, we are being told you only have 6 nurses, and supposed to be 10. Talk about that shift, the capacity per shift.
In total, let me put it this way. We have a total of 160 nurses, and they are distributed within the various working stations. We have some in labor ward, maternity theater, and newborn unit. While they are there, they distribute themselves shift-wise. So we will find that where we expect, the shift we expect to have more load, like the long day shift, we have more nurses. So actually they do go up to 10 on good day. But some days, yes, we agree, we have a short of about 2, so we get 2 to 6 nurses a shift. But at this juncture, I'd also want to bring into attention, we have a school of midwifery. So we are also utilizing the students who we are mentoring to actually help us with the workload that we are handling. Sorry?
How many
Like on a normal day?
On a normal day.
Yes, how many deliveries?
60 to 80. And sometimes it used to go to 100, but because now the county has also capacity built our neighboring health centers, our numbers have slightly gone down, but we do up to 80.
I have a question for each of you, if you don't mind. Yeah. So as the paramedics now, could any of these deaths have been prevented if the hospital was better equipped? For you, having explained all the 11 deaths, are you now saying that none of these deaths were suspicious, as the governor said yesterday, and therefore the suspended officials did nothing wrong? And for you, how does a hospital like Pangani not have a morgue?
Pumwani.
Like Pumwani, not have a morgue?
I think the 3 can be handled by one person. No, 0.
Okay. Okay, thank you very much. Let's also first of all agree that mungeniletea stool. Okay, this way. Okay. Okay, so let's agree on one thing. The county government is currently undertaking reforms in all the service delivery sectors, and one of it is in health. Why you saw the governor here yesterday is because he was answering to a distress call from one of the patients, and a husband who was reporting about the wife. He has adopted an open door policy, and he responds to issues of the public in the ways that he thinks is the best way to deal with it. And he found it wise to have an impromptu visit, which is also one of the best styles that one can use when you want to find out what is going on in an institution. One of the things that we have to also accept is that as you have been told, this is a purely maternity hospital. We serve so many people from informal settlements. The kind of population that we receive here, we deliver between 60 to 100 mothers per day. The other issue that you've asked is whether we have a morgue or not. This facility does not have a morgue, but it has a cool storage or room where the conditions can hold bodies for a short period of time. And this is an arrangement that has been on for a very long time. And as we budget in the coming financial year, we have agreed that we will have a cooling facility in this Pumwani hospital that is going to make sure that the preservation of bodies will be on time. Otherwise, we have bodies collected from this hospital every Monday, Wednesday and Friday and taken to city mortuary. Initially, it used to be done on a daily basis, but we work towards at least making sure that we have 100% safe deliveries.
Why is it then? Why is it? Kwa nini mbona ukapatikana huko kwa store? Boxes. Yes.
Then the governor acted surprised because this is not the first time. The first time bodies were stored in boxes. What options are you giving to the county government? You talked about holding, but if at all this was really there, why were these babies stored in boxes and in
So I want to point out that we have a designated room, and that is where the bodies were found. And we have to make do with the resources that we have to make sure that we package the bodies in a way that they can be transported for suitable storage and disposal in the city mortuary.
Could any of these deaths have been prevented if the hospital, as you say, was better equipped?
Now, one thing that we have to agree, none of those deaths occurred out of lack of emergency services. So because as you have heard, they could have been better operational efficiency if some of the doctors that were on call could be reached on time. But from the reports that we have received, the doctor was available, and none of those deaths occurred out of circumstances which could not be managed within the hospital. As you have seen, 4 of them were stillbirths. That means the babies were already lifeless by the time they were being delivered.
So that means what's the status of these suspended officials? They are innocent. Yes.
So on the other issues of staffing and communication from the county, I'm going to give the county secretary to give you the status of the investigations, and I want to promise Nairobians and Kenyans at large that immediately we get the report from the multi-agency, we will comply with the recommendations that will come out of the reports. Because one thing that we have to agree is that let's give also an opportunity for institutions to carry out their mandate. But we cannot sit as management and not act. We must take action, but we also must exercise fair practices that are going to also bring back the confidence of service delivery in Nairobi. So I want to give the CS. Now, the total budget for the healthcare sector for this financial year is 6.7 billion. This includes capital. Remember that we came into place 1 year ago, and there was no adequate financing of our facilities. We really want to thank the health committee of the county for allowing us now to expeditiously ensure that we have resources that can be deployed to our facilities. As you have all known, we are now expanding the facility at Mama Lucy. The 72-bed capacity is almost complete, and I'm going to welcome you. It is open. You can go and see. The roofing is on. ICU is expected to be operational in the next close to now 80 days, and we expect that such even emergencies that can be gotten from this facility can be taken care of in other county referral hospitals.
Is this a power that the emerging concerns that there's a political hand being played in the events that unfolded yesterday? And number 2, what's the status of the suspended doctors? Yes.
Okay, I'm giving that to the county secretary, who is the official head of public service, to comment on that issue. Karibu Bwana Kariuki.
Good afternoon, ladies and gentlemen. I think on the question of to this side,
And take it down a bit.
how much more do you want me to move? Is that all right? Thank you very much, Jackie. You've asked about the status of the doctors that have been suspended. As Madam Waziri has spoken, essentially that is an administrative step that was taken yesterday. As you have seen, we are already here and in dialogue with the various unions, with our own internal mechanisms of evaluating exactly what could have transpired. And for sure, the county and the leadership of the county is keen to ensure that our workers are not victimized at all in the event that none is culpable for any form of negligence or otherwise. And therefore, you would expect within a short period, our doctors, if found not to be culpable in any way, shall certainly be back to work serving the public as they normally do. But as I said, this is just purely, again, an administrative step. It is not unique to the health sector. It is what happens essentially across any other sector. And as always, we are fair and just, but we also want to be thorough because in this instance, we're talking about matters of life and death, and therefore we want to be sure that nothing that could have been done by any one of our professionals here, that no one is culpable in that respect. Thank you.
Could you address the concerns that there's a political power play in the management of the hospital?
We are here as administrators. We are not here to manage any. This hospital is run by health professionals. There's no one here who is a political player or or a politician for that matter. All these persons and professionals here are actually health professionals. And therefore, there's no politics here. We are here as administrators and as leaders in the county to essentially ensure that the health service delivery is going on as should.
Wacha niulize swali. Nimeuliza sana. Ikiwa kuna makosa ambayo yamepatikana na mnasema kwamba kulikuwa na makosa na hospitali yenyewe iko chini ya kaunti ya Nairobi, basi mwenye makosa ni waziri wa afya na serikali ya kaunti ya Nairobi, wala si hospitali. Utasema nini kuhusu hayo?
Labda hujanipata vizuri mwenzangu, manake sijasema ya kwamba kuna yeyote ambaye amekosea. Tumesema tumekuja hapa kuhakikisha kwamba kwanza ni jambo gani lilitendeka hapa.
Lakini watu wamefutwa kazi, ndugu yangu.
Si kufutwa kazi.
Wamesimamishwa.
Kusimamishwa na kufutwa ni tofauti jamani. Tusije tukachanganya maneno. That is an administrative step. Tayari nishachangia jambo hilo. Utasubiri. Wacha kwanza sisi kama county tuendelee kuchunguza ni mambo gani ambayo yametendeka hapa. Kisha ikiwa kuna mtu yeyote ambaye amefanya vibaya atachukuliwa hatua. So kuliko that suspension.
There's been evidence that public hospitals like Pumwani cannot detain patients.
We'll just be restricted to the matters that have brought us here today, if you will allow us to.
So can I assure you that the report will be out shortly, and we will make sure that all of you get informed. The county government continues to commit to make sure that Nairobians get quality services, and we will comply with the Constitution by ensuring that every one of us gets their rights. Chapter 4 of the Constitution on Bill of Rights ensures that everyone gets health as one of the basic rights, and we are committed to it. We also want to promise fair administrative justice to anyone who has been affected in one way or another in these incidents. Thank you, sir. Thank you.